Circulatory system is found in chapter 19 in your textbook. The circulatory system consists of the heart, blood vessels, and the blood. The heart is a muscle, and it has 3 layers. The endocardium is the innermost layer. Myocardium is the middle layer, and then the pericardium covers the outside of the heart. It's like the sac that the heart is in. The purpose of the heart is to pump blood. There are 4 chambers of the heart. You have the atrium that are up on the top and the ventricle that are on the bottom. The left ventricle is a big, strong chamber of the heart that pumps oxygen-rich blood to all the rest of the body. Now, I could explain the whole process of how blood flows through the heart, but there's this really awesome video that I have attached on D2L that I encourage you to go and watch, and it has a great demonstration of how blood flows through the heart. The heart, like I said, the function is to pump blood throughout the body. There's 2 phases of the heart, systole and diastole. Systole is when the ventricles squeeze or contract. So the ventricles are the bottom part of the heart. And so systole is squeeze. That's the top number of the blood pressure. And diastole is as the ventricles relax. So they're filling back up with blood before they squeeze again. Diastole or diastolic is the bottom number of the blood pressure. This is just an example of the veins. Remember that arteries carry blood away from the heart and veins carry deoxygenated blood or oxygen-poor blood to the heart. Arteries carry oxygen-rich blood away from the heart. And I just talked about that. Capillaries, that is where arteries meet the veins, and there's an exchange of oxygen and nutrients that take place there. So the blood, we have the erythrocytes, which are red blood cells. They carry oxygen. They are found in the bone marrow or made in the bone marrow. The iron gives the blood its red color. Leukocytes are white blood cells. Those help to protect the body from infection. They are produced in the bone marrow, the spleen, and the thymus. Platelets or thrombocytes, those cause the blood to clot. They are also made in the bone marrow. Plasma is the liquid portion of the blood. This is mostly water. It carries oxygen, nutrients, waste products, hormones, salts, and antibodies. Changes in the circulatory system due to aging. We know that the heart pump becomes less effective as a person ages. The blood vessels tend to narrow or become less elastic and the blood flow decreases. So it is normal as the person ages for these things to happen, which can cause all kinds of cardiovascular diseases. So here are some of the disorders of the circulatory system. Hypertension. Now, hypertension is not a one-time elevated blood pressure reading. It is consistent. It's multiple visits or multiple readings where the blood pressure is elevated, 140 over 90 or higher. A major cause of this is hardening or narrowing of the blood vessels. So that can happen through a process of time where the vessels become stiff, or there can be like plaque buildup in there that can make it very narrow for the blood to push through. Signs and symptoms are not always obvious. Hypertension is often called the silent killer. So sometimes people don't even know they have high blood pressure. Treatment can be medication, exercise, or a low-fat, low-sodium diet. Another cardiovascular disorder or disorder of the circulatory system is coronary artery disease, or CAD. And this is when you have a buildup of plaque in the arteries of the heart. The myocardial ischemia, that is where you have blood supplied to the heart muscle that's reduced. So that can cause chest pain because there's lack of oxygen getting to the heart. And then angina pectoris, this is chest pain due to cardiovascular or coronary artery disease. And you have stable and unstable angina. Stable angina is if I go out and mow my grass and I have chest pain as a result of that because I have an increased need of blood flow to the heart, that would be somewhat expected, right? Because I just exerted myself. So that's considered stable angina. Unstable angina is I'm sitting in my recliner watching Family Feud, and all of a sudden I'm having chest pain. There's not an increased demand for oxygen to the heart or blood flow to the heart, but I'm having chest pain without that increased demand. So that's unstable angina. Angina is typically treated through rest or through nitroglycerin. Nitroglycerin are little pills that are usually in a brown bottle, glass bottle, and they can be slipped under the tongue, and they dilate the blood vessels to bring more oxygen to the blood, to the heart. So this can be done up to 3 times. And if you're still having chest pain after that third one, you need to go to the emergency room. There's a myocardial infarction, and that is a heart attack. Sometimes you can hear that called an MI. All or part of the blood supply to the area of the heart muscle is blocked. So when that blood supply is blocked, there's no oxygen getting through there. And so the heart muscle is dying at that point. Next, we have congestive heart failure. And congestive heart failure is when the heart fails to pump efficiently. Sometimes this can happen from a previous heart attack. So the heart muscle is damaged because there's lack of oxygen to the heart, and that makes the heart a less efficient pump. Some of the signs and symptoms that can come about because of congestive heart failure would include edema or swelling, difficulty breathing, or weight gain. So just a fun fact, right-sided congestive heart failure results usually in swelling of the extremities, and left-sided congestive heart failure typically results in fluid in the lungs or in causing shortness of breath. So when you take time to look at that blood flow through the heart video, think about that and apply what you just learned with the congestive heart failure. Treatment for congestive heart failure is diet, so probably a low sodium diet, medications, possibly a diuretic to help pull extra fluid off so it's less work for the heart, and fluid restriction because we don't want to overburden the heart with a lot of extra fluid to push around. Anti-embolic stockings. You can find out more information about this on page 352 and 353 in your textbook. These are also called TED hose. The purpose is to increase blood circulation. This is used to prevent thrombus in the legs or blood clots in the legs. They can be knee high or thigh high. They do have to be ordered by a doctor. There are different sizes according to the size of a person's leg. And it's best to apply it in the morning when they're lying down because that's when the legs are at the smallest. They can be very tricky to get on. A thrombus, we know, is a blood clot that's stationary. So usually that's in the calf, and it's called a DVT or deep vein thrombosis. An embolus is a blood clot that has broken loose and is moving through the circulatory system. This can lodge in the heart, lungs, or brain, and it can be fatal. And last, the sequential compression device. This is a machine that inflates and deflates to stimulate the muscles in the legs as if they were walking or doing normal activity. So after a person has surgery or if they're in bed for an extended time, they often will have these SCD device around their legs. And they inflate and deflate, and it's pumping the legs just like if they were walking. This is used to prevent blood clots.